Hello, I'm James with TextGen, and today I'm super excited about being with a client and a new friend that we've got to know over, I don't know, Stacy, how long we worked together now. It's been a little bit of time, but I've really enjoyed getting to know you, and I want to introduce you to the TextGen audience and for them to hear a little bit of your story. So I'm today with Stacy, and Stacy, I asked you in the onset so I wouldn't butcher your last name, and I'm going to do it anyway. You ready for this?
Do it.
It's going to be painful. All right, Stacy Buono. Good enough?
It's good enough.
With RWJBarnabas Health. One of our amazing heroes through COVID, who's been on the front lines right there in the pandemic. So very grateful, Stacy, for you, both as you're just the person that you are, the work that you do, and just love to spend some time and get to know you. So tell us who you are. Like let's get your origin story since you are the
Sure.
superhero.
Well, okay. Well, I'm not the superhero. And to be clear, I wasn't on the front lines. I'm just sitting at home doing the fundraising for the real heroes that are out there every day treating people the past year. So I can't take any credit for that.
Fair
Clearly,
enough.
I'm home with my house while they're at the hospital.
Oh,
Well, I'm
fair enough.
Stacy. I'm not even going to try to correct the last name. I'm going to leave it out there the way it is. It's good. It's the non-Italian version. I like it.
For
So,
sure.
so I live on the Jersey Shore with my family. My husband, he's a professional musician. My sons are 16 and 18, so the house is chaos all the time. It could become chaos in the next half hour. I can't guarantee any of that.
One
There's
can
also a
only
big
hope.
dog. Yeah, the dog will bark because, I order everything online now. So there could be stuff happening. I'm not sure what's going to happen here, but we're in close quarters the past year. I'm working from home. The kids are doing college and high school from home. So here we are. I mean, normally we enjoy being on the Jersey Shore. We love the beach. We love to
Love it.
travel. We love animals. We're the typical New Jersey family, I think. Not the Jersey Shore family, but the normal New Jersey family.
The normal New Jersey. I'm glad you made that distinction
Yeah,
because I was starting to wonder,
yeah.
but thank you for that.
No.
That's awesome. So Stacy, tell me a little bit about what you do now. What do you do for work?
Well, I am the AVP of Annual Giving and Donor Relations. I never say that. I'm not a title person, but that's my big title at RWJBarnabas Health. We are currently an 11 hospital healthcare system in New Jersey, potentially soon to be bigger. And I do all of the annual giving for all 11 hospitals and our behavioral health center. So all the direct mail, all the online
Hmm.
giving, all the emails, everything that has to do with annual giving is me and my one other staff member, Carly, just the
Love it.
two of us.
Just the two of you and all the annual fundraising. That's amazing. So and how
Yeah.
did you come to do that work? Like what led up to
It's
that?
a, it's hard to describe. I actually was a journalism major in college. I went to Rutgers University,
Okay.
and I was a newspaper reporter by trade for the first several years after school. At a time where newspapers already back then, I'm not going to say what year,
Right.
were already
Last
being
year.
bought up and changed. So I was with a paper here called the Asbury Park Press.
Okay.
Gannett, a big company, came in and started kind of taking over, and all of us younger reporters started to scatter. We didn't know what to do. So I took all kinds of weird writing jobs. So I would like to tell my kids, if you can write, you can do a lot of things. So
Right.
I wrote vitamin labels. I wrote computer manuals because computer people don't know how to talk in
Yes.
real people language.
They work
All
for
these
me. I
different
know who they
jobs,
are.
yeah, exactly. And then I kind of just fell into a fundraising consulting firm, and I was writing the appeals for all these different organizations. The University of Texas, the a ballet organization, the Betty Ford Center. So I was kind of part of the process of doing annual giving for all these different clients, and then started working for institutions. My family, we moved up to Massachusetts. I worked at UMass and Amherst for a couple of years. My husband was a professor at Berklee College of Music. So we move around a lot, and I've always kind of landed at a different nonprofit. So eventually I made it into healthcare, not even really sure how. And I've been here at RWJBarnabas Health for the past 6 years.
Wow, 6 years, what in a journey. You know, it's so funny because when we start out as kids, I think we know what we're gonna do, right?
Oh
Um,
yeah, I have two of them in the house that know everything. So yeah. We
Yeah,
do.
and I just heard somebody speaking. I attended an online event, and they said something that I just had to write down. It was brilliant. But what he said when he's planning his calendar, he says 3 days is firm, 3 weeks is a little fuzzy, and 3 months is fiction. And I thought, that's it. Like, how often do we try to plan the quarter? Get 90-day plan, and we should. You should certainly plan, but just have some flexibility. But life, man,
Oh,
takes us
yeah.
in a lot of directions, doesn't it?
It does. It
I
definitely
love it.
does.
Well, Stacy, one of the things that I think we do in fundraising really well, and I'm going to throw this out there and see what you think about it. But one of the things I think we do is we tell our story to allow other people to kind of enter into how they see ourselves in their story. So we enter into the story, if you would. So you
Hmm.
mentioned UT, University of Texas. I graduated from University of Texas. So, as soon as you said that, I sparked, oh, there you go. There's some similarity there, right? And the second thing, you mentioned Massachusetts. I grew up in Acton, Littleton. I don't know if you know where that is,
Oh,
but about 26 miles west of Boston. So I'm a Massachusetts boy and a UT grad. But this isn't about me. It's about you. But the point is, it's just neat to see how our stories kind of overlap in ways. So that's cool. Very neat.
oh yeah. Well, when I moved to Massachusetts, I was doing a lot with parents of students and traveling around a lot. And I lived in the Amherst area. So luckily I had a friend from Southie. And before I traveled anywhere, I would ask him how to say the name of the town, because you people don't say all the letters.
Yeah.
It was very confusing for a transplant to move to New England. It's very confusing.
It is, especially if you have an Italian last name.
Oh yeah.
Like I can say Worcester. I cannot say Bono.
Yeah, I
Whatever.
can say Worcester now, but I couldn't when I moved there.
We can always tell when people from out of town, they say, how do you get to Worcester? I'm like,
Yeah, Worcester,
you're in a rental car, aren't you?
Haverhill. It was a lot of information for me, but it was a good lesson. Good lesson.
That's great. So Stacy, if you think back over your journey to get to where you are today, like what along the way do you feel like have been some of your bigger aha moments, some of your learnings that you would like to share with our audience and community here?
That's a great question. For me, being an annual giving person, and also being a professional writer, I love to hear people's stories.
Oh,
And
yeah.
that's where the healthcare connected for me in a way I never thought it would, because it's a little different than hearing an alum story about their college days. You're literally hearing people's life and death journeys. I mean, I'm talking to people whose lives were saved in these hospitals, and it's overwhelming sometimes to become a part of their story. They're really sharing their life with you.
Yeah.
So that part is my favorite part. I love talking to grateful patients. We'll call them grateful patients, because there's the ones that aren't so grateful, but I don't get to talk to them. But I also I'm not a major gifts person. So when I get to see the $25 check come in from the patient who writes a little note, I wish it could be more, they were angels. That's so meaningful, because these people, the amount isn't what matters with annual giving, as we all know. And also it just speaks to people's level of commitment. They just want to help on whatever level it is. So I kind of love that part.
I would imagine. I mean, what a rewarding experience just to open the mail time after time and story after story and see, the gratitude pouring in. That's amazing. That's great. And what along that, as you think about, because with every great opportunity comes some challenges, some, leveling up to the next level. But what have been some challenges that you've had to deal with, both either personally, professionally, and, along the way in your role with annual giving?
I think professionally, I've been pretty lucky. I'm a very open person. There's I don't pretend to be someone I'm not. If I have to wear a suit, I'm uncomfortable. So I'm very casual. And to your point, I don't try to plan too much because personally, we've had to deal with some big stuff. I mean, we moved back to New Jersey and then literally got our life wiped away by Superstorm Sandy, not long after we came back to New Jersey. So lucky for us, we had family members that could take us in, but we watched a community struggle. And those are the things that have really shaped my life more than professional experiences, and also taught me not to get so hung up on the professional letdowns. Things are going to come your way, and you kind of just have to go with the flow. And I meet now with the VPs of each of our foundations monthly, mostly now on the phone. But every month I present them with the plan, and every month we throw out the plan and start over. And I think that some of those personal experiences have taught me to do that in my professional life, and just being a mother too, especially to teenage boys. You need to just accept that you have no idea what's going to happen from one minute to the next. You don't ask too many questions, and you kind of just move forward.
Control is such an illusion, isn't it? It's not even real.
Oh God, yeah.
Yeah.
No, and you learn that pretty quickly when you literally have to put the contents of your life to the curb. I mean, literally. So you kind of start to really appreciate the experiences that you have, the people in your life, especially your work colleagues. You spend so much time with them. And when they come through for you on a personal level, that means so much.
Yeah.
So, that kind of shapes your experience with your employer for sure.
It would seem to me then, Stacy, what I hear you say is that your own suffering, right, your own pain, if you would, has really, I think, fostered more empathy, right, more compassion in the service of others. And when we're working with people that are in life events, and I've been hospitalized with and it wasn't something I planned for. It's not like I woke up and said, you know what I'm going to do? I'm going to go spend a couple nights in the hospital and go check into the ER. That's a great idea, right? That's not what I wanted to do. So I think that, you're meeting people in their worst moments, and you bring with that your worst moments and your experience in that, and that brings compassion. And maybe not you necessarily in the emergency room with them in presence of a body, but certainly in presence of spirit and in thoughtfulness and the way you conduct yourself in your 8 to 5 experience at the hospital, right? It takes everybody behind the hospital. It makes it actually work at the street level. So what an amazing ability to take that past and to shape that into empathy to serve. I love it. That's great.
Yeah, I mean, it teaches you, and my children learned very early on that you don't know someone's past or their experiences, and you don't know where they've come from. So it's always important to listen to their perspective, because you'll start to figure out, not that the why is important, but you'll start to figure out that people feel differently about things, especially now, political issues I don't even like to talk about, but at least being able to empathize and understand that you don't understand where someone's coming from. You know what I mean? Like you don't get what they went through to get where they are. So just respect their opinion.
Yeah. No, I couldn't agree more. And I think that at the end of the day, we're all humans, and it's in our humanity when we show up the most human is when we're most compassionate and kind to ourselves, of course, to our family and to others. So I think as a agent, if you would, of love, which is what philanthropy is, right? You're enabling people to get on board and opportunities to annually really ride that wave with you to be in that service. And what a tremendous opportunity for your givers and those that support the hospital as they do, but also for those that have experienced it. And it seems to me, you mentioned the $25 checks. It seems to me that if you've gone through suffering, or if you've been in a situation where you're looking up at a group of angels caring for you, as you said, those are definitely, I think, the people that have the gratitude, and they'd rather give a little bit of anything, right? I think it's absolutely amazing.
True.
So as you think back on your experience, we talked a little bit about your the lessons learned, the opportunities that you've had. If you could go back, I don't know, I'm going to say 10 years ago, and coach Stacy on something, knowing that a lot of people that listen may be newer to the roles or newer in their journey. What do you wish somebody would have told you that they hadn't told, that you had to learn the hard way?
You don't know everything, even if you think you do. I think just being open, that's not always easy to admit.
Yeah.
Being open to experiences and being open to other people's experience. Even if something professionally, I mean, even if it doesn't seem like the way you might do something, try it. Listen to every different perspective, and just honestly work hard. I mean, I know there's days even now where I feel like this is insane. How do they expect me to do all this in one day? You have those moments of, oh my goodness, I can't drink enough coffee to do this, but you can. Yeah, you can. And it is overwhelming. And this past year, I think, has proven to us that you can get through a lot. I mean, you have to adapt. So just not being rigid and being willing to listen to other people's opinions and being able to listen to critiques of yourself. That's always tough. I mean, I remember sitting in that first formal review when I started working in healthcare, because when you work at colleges, nothing's formal, right? You're sitting in a weird library on campus with partitions, and it's crazy. I mean, people are in jeans and people are yelling over walls, and there's not a lot of structure. But then, you know, you go to healthcare and you kind of have to take out the nose ring and pretend to be a little different, which is kind of what happened to me when I came back from hippie Massachusetts, and then I was in corporate New Jersey, and it was a little bit of an eye-opener. But I think sitting in that first formal performance review as someone in their 30s, as a parent, and feeling like I knew a lot, I realized I didn't know all that much, and that I needed to take criticism better. I needed to listen to other people's feedback on what I was doing and not feel like I just knew it all. And that was tough. But then once I got to a point where I was able to do that, I think it really shaped who I am as a person and enabled me to move on in my career to a place that I really enjoy being in now.
I love it. It seems so. I heard you say be open to new ideas, open to new experiences, and then of course open to some hard things to hear, even if they're about ourselves. Because it's really, I think, as I've listened to you, it's really about how you leveled up, isn't it, Stacy? How you've been able to not internalize the criticism and go down and closed off and have scarcity, but to be more open to say, hey, you know what, that was helpful, you know, then this is how I can show up now. And to be a bit, you know, aware of our context and the change with the times and the organizations that we serve, right? For sure. Yeah. Good.
Absolutely.
Well, that's outstanding. So you know, when I first, one of our first conversations, Stacy, that struck me, and I was asking you, you know, when you first started working with Riley, like what are the challenges you're facing, like, you know, daily? And I remember you said something that really struck me. In fact, I later tried my hand at creating a little cartoon in Canva. I'll send it to you. It's easy, but they have a little cartoon tool, and I was like, I'm going to figure this out. So I cartooned our conversation, but there was the idea of people showing up at the emergency room with a bunch of pizzas or sending pizzas to the emergency room. You remember that conversation?
Yes, I lived that for several months last year.
Yeah. So I said, Stacy, right now, we all have an overwhelming sense to help our first responders. I'm seeing it in, you know, all these, you know, YouTube, you know, TikTok videos. Everywhere I turn, I'm seeing healthcare, you know, and first responders and all this love pouring out, because we recognized that it was out of control, and we were very concerned, a lot of us, you know, and I'll speak for myself. And the thought that there were people just down the road from where I live ready to take care of me if the need should arise, because it was all scary and new. It was our first global pandemic. I don't know how many you've lived through, but this was my first one. so I didn't know what to do. I mean, like anytime you do anything for the first time, it's a little scary, right? So, but the outpouring of love really expressed itself, as I recall, in people showing up with pizzas. And you said, yeah, we're very grateful, but the community, we need to rally the community in a way where they are really, you know, helping us with things that we need. And it's really hard to take off the face, you know, shields and all the material that we're in to serve these patients, and then eat a pizza that's been passed around by, you know, how many people, right, in the states that we're in. So,
exactly.
Yeah. So like, do you remember that conversation? I'm just wondering kind of how you navigated that and kind of what your experience was through that. I think our audience would love to hear kind of some frontline stories on that.
Yeah. I do remember, because I think we had spoken a couple times, and that's when we decided to pull the trigger on a texting program. Because of being in healthcare, it's a little different than some grassroots organizations. We don't have a ton of online traction when it comes to giving, but we clearly have websites. I mean, people are going to our websites to look for doctors and, you know, look up health information. They're not really thinking about philanthropy at that point.
Sure.
But we also knew that we were in a situation where, you know, it was our version of a natural disaster, if you will. I mean, we were in the middle of a situation where, the community, all they wanted to do was help us, and they didn't know how. So, you know, buying food for the staff, of course, seemed like the logical thing to do. These people are in the hospital, they need to eat, they need a break, and it was lovely. But we also needed to try to help them understand the actual needs. I mean, there were situations where we didn't know if we had enough PPE? Did we have enough masks for nurses to not have to reuse one for more than one shift? Do we have enough gowns? Unfortunately, we had situations where family members were communicating some really tough conversations via iPad. Do we have enough of those devices so that anyone who needs one will be able to use one? I mean, that's horribly sad to say, but there was a lot of final conversations that happened through technology. And I'm getting a little choked up, and I wasn't even there, but but those were tough. Yeah, those were tough, and it was hard as a fundraiser to hear those needs coming in from the frontline people. So then we had to try to figure out, how do we communicate this to the public? Like, what's the best way to do that? So, we wanted every channel available. We were blasting out emails. We had more response than we've ever had before. Anyone who ever was afraid that I was sending out too much email, all of a sudden they didn't care if I was sending out too much email. Our direct mail pieces, we switched topics and we sent them out earlier, and we did everything we could do. So we figured we've got to get texting out there too as a channel for people. And we really just tried to hone in on the fact that, we actually needed things. It's a lot harder with the hospitals because the things we typically need are huge ticket items. Yeah. So we can't say, hey, we need a new, I don't know, radiation treatment, or we need a new CAT scan machine. No one can afford that, right? Sure. Whereas some organizations can equate it better. Like, if you give $20, you can feed a person for a day. Sure. So we actually finally had that. If you give $20, we can provide X number of masks to make sure our nurses are safe when they're helping COVID patients. So that's kind of what we had. The biggest thing, I think, was just being able to have the vehicles available and being able to get a clear message to the public. It wasn't giving. All of a sudden, everybody wanted to give to the hospital. So that was fantastic, but it was just kind of channeling it the right way, away from the pizzas and more for the outright. I mean, those were wonderful gestures, but if you took the money you spent on the pizza and you donated it to the hospital, we could buy a lot of protective equipment that we really truly needed at that point.
I love it. And our tagline with TextGen, which we call it TextGen because it's a play obviously on next gen, right? And we want you to use texting whether you use Rally or not, to be clear. Like, of course we'd want to work with you, and I wouldn't have built a company if I didn't feel like we were really good at it, right? But I just want people using texting because it's where the people are. It's the one device that we all carry with us all the time. So it's just such an obvious thing. We text our friends and our family. We should text, but this isn't a plug for texting as much as it is that, our tagline at TextGen is to mobilize nonprofit leaders mobilizing their mission. And, of course, mobile phones is a play on that, but really what you're describing, Stacy, hits the nail on the head. And that's that you need to channel people on a channel that they're on, meet them where they are, and then move them to the desired action, mobilize them for a cause, rally them around your work. And, if we show up at a crisis, and we all show up with the right heart, but the wrong thing, it's beautiful, but it's not as helpful. If we show up with the right heart and then the right thing in our hands, whatever that is, that's fantastic. I know I did a home build with a nonprofit, and I showed up with my little rinky-dink tool set, and they smiled. They're like, "That's cute, James. Like, use our tools, please." So you want the people showing up with the right stuff to be able to get the job done. And I think that's best realized in how we communicate. Would you agree with that?
Oh, absolutely. And I mean, to your point, I got off a call this morning. So now each of our affiliates wants their own texting program. Yeah. So I've been doing demo after demo with RallyCorps because our hospitals are very different. I mean, we span New Jersey. So we have hospitals in more rural areas. We have larger hospitals. We have hospitals in urban areas, and they all want to use it for different things. And it's very interesting. But to your point of kind of getting people where they are, we've always had a challenge, and I think all healthcare organizations do, with getting donations from physicians. And I think part of it is that we just can't get the right vehicle to get to them because they're busy. They're not opening their mail. We don't know how to really get in touch with them. However, they all have a phone. So we've been kind of throwing around the idea of doing a text campaign to doctors around Nurses Week in May, which I kind of find brilliant. I'm kind of very proud of myself.
I love it. You should be proud. It's
So
a
we'll
great
see.
idea.
I mean, I don't know. We'll see how proud I am after the results, but I think it's a really cool example of what you're saying. Is we have to think about, everyone's got their phone on them. My 16-year-old never leaves without the phone, and my 68-year-old mother never leaves without the phone either. You know, she's texting me all day. So we have a captive audience. So send them the messaging. It doesn't necessarily have to be a plea for a gift, but you can direct them to different things as an organization. Sure. You can direct them to information. You can direct them to an event, or a specific need that you have. So it's been really interesting to listen to each of the hospital foundation staffs and the different ways they want to utilize the technology.
Sure. Yeah, no, I get it. And we work with a lot of hospitals, and they all use it just slightly different, you know, some of the same ideas, but absolutely. I think at the end of the day, it's about meeting people where they are and communicating with them, whether you know, and whatever that is. And some organizations it's direct mail. I mean, there's not one magic bullet and one channel. What the goal is to meet people, communicate clearly, and then move them to action, move them to act in the right way, to shape that action, of course, so that they're most impactful. So, well, you know, Stacy, I really enjoyed our time. I know we're right at the limit. I told you, as a busy mom and a busy philanthropist, all of the work that you're doing, and we need to, you know, honor your time. But how do people get in touch with you? I know you're in the various groups, either Facebook or LinkedIn. I'm not sure which platform you prefer, but like, how do people find you and connect with you? And then, of course, you know, since you're on Rally, you know, if you want to give the short code that people can text in to donate if they want to get involved. But how do you do that? Yeah.
Well, currently our system level account is, you text RWJBH to 24365, but we're about to have several others. I'm not sure exactly what they're going to be yet.
We'll publish them when we have them. How's that?
Exactly. I work from home now, so I have no office information. And social, I should be better with LinkedIn. I concentrate on the stuff that my kids are on. You know, got to do a little spying.
Yes,
I warn you now that if you look for me on Facebook, I will friend you. However, my goal on Facebook is to make people laugh, because I think it's a little too serious. I don't want to hear about politics. I want to see pictures of dogs and funny things. So you know, mildly offensive, funny stuff is my style. So if you're into that, you can clearly find me.
If not,
by just
don't worry
using
about
my
it.
name.
That's right. I love it.
If that's not your thing, don't friend me on Facebook.
Well, I'm with you. I sign up for all the early all the new social apps, because my teenagers, and I like you, I'm a spy. You gotta watch that. But what's fun is, I mean, I'm not a spring chicken, and it's just really fun to get in there and be like, oh, this is how that works. So
that's how I felt about texting when we started last year.
I know, right? That's great. Yeah, it's so funny. Well, Stacy, I really appreciate your time and the energy you bring to your role. I know our team really enjoys the conversations that we have, and thanks for being both a client of Rally, of course, but more importantly, the work that you do, and being, you know, behind the front lines people, you know, making sure we all stay safe. So thank you very much. Appreciate it.
Thank you.
All right.